How heart attacks happen. Complete guide to myocardial infarction, symptoms, and prevention. 3D medical animation. The heart attack crisis. Every 40 seconds, someone in the United States has a heart attack. That's over 805,000 heart attacks happening every single year in America alone. In Canada, approximately 162,000 new cases of heart disease are diagnosed annually, with thousands suffering myocardial infarction. Heart disease remains the leading cause of death in the USA and the second leading cause in Canada. But here's the critical question. How do heart attacks happen? And more importantly, how can you prevent them? In this comprehensive 3D medical animation, I'll show you exactly what happens inside your body during a heart attack, why they occur, how fast heart attacks can happen, how young people can experience them, and the life-saving information every person needs to know. Whether you're concerned about your heart health or want to protect your loved ones, this video could save your life. Let's dive into the science of myocardial infarction. What is a heart attack? Medical definition. A heart attack, medically known as myocardial infarction, occurs when blood flow to a section of your heart muscle becomes blocked. Your heart is a powerful muscular organ that pumps blood throughout your entire body, delivering oxygen and nutrients to every cell. But your heart muscle itself needs a constant supply of oxygen-rich blood to function properly. This blood supply comes through specialized vessels called coronary arteries. These arteries wrap around the surface of your heart like a crown, which is why they're called coronary, from the Latin word for crown. When one or more of these coronary arteries becomes severely narrowed or completely blocked, the heart muscle downstream from that blockage begins to die from lack of oxygen. Look at this 3D animation of a healthy heart. You can see the coronary arteries delivering oxygen-rich blood to every part of the heart muscle. The blood flows smoothly through open, flexible arteries. But when a heart attack occurs, this critical blood flow stops and heart muscle tissue begins to die within just 10 to 15 minutes. This is why understanding heart attack symptoms and getting immediate medical attention is absolutely crucial for survival and recovery. How heart attacks happen, the process. So, how do heart attacks happen? The process usually begins years before the actual heart attack occurs. It starts with a condition called atherosclerosis, the buildup of plaque inside your arteries. This plaque consists of cholesterol, fatty deposits, calcium, cellular waste, and other substances that accumulate on the inner walls of your coronary arteries. Watch this 3D animation showing how plaque develops. Over time, these deposits grow larger, making the arteries narrower and stiffer. This is coronary artery disease, the underlying cause of most heart attacks. As plaque builds up, it reduces blood flow to your heart muscle. You might experience chest pain called angina during physical activity when your heart needs more oxygen but can't get enough through the narrowed arteries. But here's the critical moment. Why do heart attacks happen suddenly? The answer lies in plaque rupture. Sometimes the surface of a plaque deposit cracks or tears open. When this happens, your body responds by forming a blood clot at the rupture site to seal the damage. However, this blood clot can grow large enough to completely block the artery, cutting off all blood flow downstream. This is how most heart attacks happen, a sudden blockage caused by a blood clot forming on top of plaque rupture. Without blood flow, the heart muscle begins to die. The longer the blockage remains, the more heart muscle dies and the more severe the damage becomes. This is why every minute matters during a heart attack. How fast do heart attacks happen? Timeline. How fast do heart attacks happen? This is one of the most important questions for patient education. The answer varies significantly. Some heart attacks strike suddenly without warning. These are called sudden heart attacks. The person may feel perfectly fine one moment and experience severe symptoms the next. However, many heart attacks actually provide warning signs hours, days, or even weeks before the major event. You might experience episodes of chest discomfort that come and go, shortness of breath, unusual fatigue, or other subtle symptoms, these are warning signs that your coronary arteries are severely narrowed. How long do heart attacks take to happen once symptoms begin? Heart muscle damage starts within 10 to 15 minutes after blood flow is blocked. A typical heart attack lasts anywhere from several minutes to several hours. During this time, heart muscle tissue is actively dying. This is why emergency medical treatment must happen as quickly as possible. How often do heart attacks happen? In the United States alone, approximately 22,000 heart attacks occur every single day. That's roughly one heart attack every 40 seconds. How many heart attacks happen a year? Over 805,000 annually. In terms of how many heart attacks happen a day globally, the numbers are staggering. Cardiovascular disease causes millions of deaths worldwide each year.
Age factors: how young and old. How old do heart attacks happen? And how young can heart attacks happen? These questions surprise many people. The average age for a first heart attack is approximately 65 years for men and 72 years for women in the United States. However, heart attacks are increasingly affecting younger adults. Here's an alarming statistic. About 1 in 5 heart attacks now occurs in people aged 40 and younger. How young can heart attacks happen? While rare, heart attacks can occur even in teenagers and young adults, especially those with genetic conditions, severe obesity, diabetes, or who use drugs like cocaine. The risk of heart attack increases significantly with age because plaque buildup in arteries is a gradual process that accelerates over decades. Men face higher risk starting around age 45, while women's risk increases dramatically after menopause, typically around age 55. This is why regular cardiology checkups become increasingly important as you age. But don't assume you're safe just because you're young. Heart disease doesn't discriminate by age. If you have risk factors like high blood pressure, high cholesterol, diabetes, smoking, obesity, or a family history of heart disease, your risk increases regardless of your age. This makes patient education and early prevention absolutely critical for everyone. Silent heart attacks and sleep. How do silent heart attacks happen? Approximately 20 to 45% of all heart attacks are silent, meaning they occur without the classic dramatic symptoms. Silent myocardial infarction happens when the heart attack causes minimal or no symptoms that the person recognizes. You might feel unusual fatigue, mild indigestion, or slight discomfort that you dismiss as nothing serious. Silent heart attacks are particularly dangerous because people don't seek immediate medical attention. The heart muscle still suffers damage, increasing the risk of future heart problems, heart failure, and sudden cardiac death. Silent heart attacks are more common in people with diabetes, women, and older adults. How do heart attacks happen in sleep? And how often do heart attacks happen while sleeping? Research shows that heart attacks are more likely to occur in the early morning hours, between 4 a.m. and 10 a.m. This happens because of natural circadian rhythm changes in your body. During these hours, blood pressure rises, stress hormones like cortisol increase, and blood is more likely to clot. How often can heart attacks happen to the same person? Unfortunately, having one heart attack significantly increases your risk of having another. About 1 in 5 people who have had a heart attack will be readmitted to the hospital for a second one within 5 years. This is why cardiac rehabilitation and lifestyle changes are absolutely critical after surviving a myocardial infarction. Heart attack symptoms: what to watch for. Recognizing heart attack symptoms can save your life. The most common symptom is chest pain or discomfort, often described as pressure, squeezing, fullness, or pain in the center of the chest that lasts more than a few minutes or goes away and comes back. This is your heart muscle crying out for oxygen. But heart attack symptoms vary significantly, especially between men and women. Men typically experience the classic chest pain. Women are more likely to experience
atypical symptoms, including shortness of breath, nausea, vomiting, back pain, jaw pain, or extreme fatigue. Many women describe feeling like they have the flu before a heart attack. Other critical heart attack symptoms include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. You might experience cold sweats, lightheadedness, or sudden dizziness. Some people describe a sense of impending doom, a feeling that something is terribly wrong. If you or someone near you experiences these symptoms, call emergency services immediately. Do not drive yourself to the hospital. Do not wait to see if symptoms go away. Every minute of delay means more heart muscle dies. Emergency medical teams can begin life-saving treatment immediately, significantly improving survival rates and reducing permanent heart damage. Prevention, protecting your heart health. Now let's discuss the most important topic, how to prevent heart attacks and protect your heart health. The good news is that up to 80% of heart attacks are preventable through lifestyle modifications and medical management. First, control your risk factors. High blood pressure, high cholesterol, diabetes, obesity, and smoking are the major contributors to heart disease. Work with your healthcare provider to monitor and manage these conditions. Take prescribed medications consistently. Drugs like statins, blood pressure medications, and aspirin can dramatically reduce your heart attack risk. Second, adopt a heart-healthy lifestyle. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting saturated fats, trans fats, sodium, and added sugars. The Mediterranean diet has been proven to reduce heart disease risk significantly. Third, exercise regularly. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity weekly. Physical activity strengthens your heart muscle, improves blood circulation, helps control weight, and reduces stress. Fourth, manage stress through meditation, yoga, adequate sleep, and social connections. Chronic stress contributes to heart disease through multiple pathways, including elevated blood pressure and inflammation. Fifth, avoid tobacco in all forms and limit alcohol consumption. Smoking damages your arteries and dramatically increases heart attack risk. Understanding how heart attacks happen is the first step towards prevention. Your heart works tirelessly every second of your life, pumping blood through thousands of miles of arteries and vessels. Protecting your heart health through knowledge, prevention, and early intervention can add years to your life and life to your years. Remember, heart disease is largely preventable. Know your numbers, blood pressure, cholesterol, blood sugar, recognize heart attack symptoms, seek immediate medical attention if symptoms occur, and most importantly, make heart-healthy choices every single day. Subscribe to Health Science 3D for more life-saving medical education. Share this video with everyone you love. This information could save their life. Next video, we'll explore the latest breakthrough treatments for heart disease and how modern cardiology is revolutionizing patient outcomes. Thank you for watching and take care of your heart.